they started telling me about the prize, and my wife started screaming very loudly, and so it was it was a little chaotic at the beginning.
The American scientists taking home this year's Nobel Prizes in medicine and chemistry.
What were you doing earlier today?
College students get hands-on experience in a simulated ER to explore careers in medicine. And October is Breast Cancer Awareness Month. We look at the surprising reasons more young women are being diagnosed. Welcome to Eye on Health, where we focus on stories that affect your physical and mental well-being. I'm Bradley Blackburn. Back-to-back hurricanes have ravaged the southeast. Emergency medicine doctors say being prepared for these extreme weather events is critical. Naja Sherman has more from Miami.
As residents clean up from two historic hurricanes.
Everything everywhere. It just looked like a tornado hit it.
Get all the furniture out so it's not just sitting and growing mold.
What's left behind can threaten lives in other ways.
Every person should be prepared for storms or for other emergencies.
Cleveland Clinic emergency room physician Dr. Rebecca Merrill says if you are without power and running a generator, keep it outside, not too close to the house.
You do not want to use a generator in a closed space that is not well ventilated because there is a risk of carbon monoxide poisoning. And this is an odorless gas. There's no good way to detect this, and it can be fatal or can make you ill.
Make sure the scene is safe before starting the cleanup with no downed power lines. Never enter any standing water, and wear appropriate protective gear if you're entering a damaged area.
You always want to involve a professional company with flooding if you can, but getting the water out and then adequate ventilation and fans usually to fully dry any materials are very important. If those are not fully dried, you do run the risk of mold or other contaminants, and that can cause respiratory symptoms.
And the sooner the better to dry the environment. Mold can start growing in 24 to 48 hours according to FEMA. Naja Sherman, CBS News.
The impact from Hurricane Helene is being felt far from the southeast. There's a critical shortage of IV fluid after the storm knocked out production at a North Carolina medical manufacturer. Stephanie Stahl has a look at how one Pennsylvania hospital is dealing with this problem and what experts say needs to happen to help medical centers around the country.
It's a mainstay of medicine. IV fluids are used to hydrate patients and deliver medications, but the solution of sterilized water and salt is in short supply. That's because Hurricane Helene damaged the North Carolina facility Baxter International, that's the leading supplier of IV bags.
This is precious now. That's why I won't take it out of the bag to show you.
Dr. Jonathan Stallkamp, the chief medical officer at Mainline Health, says the system that includes 4 acute care hospitals uses about 1,000 IV bags a day. But now, because they're being allocated by the federal government, it only has half of its normal supply.
It means we have to change how we do business. It means we have to go ahead now and change how we hydrate patients. We're encouraging a lot more patients now to give them a bottle of Gatorade.
The American Hospital Association says there are already substantial shortages impacting patients that are expected to get worse. The association is asking the Biden administration to declare a national emergency to ease restrictions on supplies. The Department of Health and Human Services has said it's evaluating a number of options.
Certainly something that's affecting hospitals across Pennsylvania and quite frankly across the United States.
Christopher Chamberlain with the Hospital Association of Pennsylvania says if the shortage gets worse, some hospitals may have to delay procedures that aren't urgent.
Looking at elective procedures, elective surgeries, and maybe postponing them for now. Now, the challenge is those are short-term strategies.
Most hospitals are now imposing conservation measures, only using IV fluids for critical needs, hoping the government quickly finds a solution for the shortage. Stephanie Stahl, CBS News.
A phone call in the middle of the night can be frightening, but at this time of year for some scientists, it's one they've worked their whole careers to receive.
It was, I'm the secretary of the Nobel Committee and I bear good news. And I sort of knew when I answered. And Natasha, my wife figured out that it was, she goes, it's a Swedish accent.
Professors Gary Ruvkin and Victor Ambros got that call from Swedish officials awarding them the Nobel Prize for Medicine for their groundbreaking discovery of microRNA. The Nobel Assembly said the discovery adds to our understanding of how organisms develop and function hopefully leading to more powerful treatments of diseases like cancer. The two American scientists studied how tiny pieces of genetic material control what cells do by looking at mutations in worms.
And our goal was to identify what was the gene product, what was the molecule or molecules produced from a particular gene. Now, we knew there was a gene there because there was a mutation in this worm. And the mutation in the worm caused the worm to develop in a way that was pretty crazy.
Each winner also received $1 million.
For computational protein design.
Just days later, the Assembly awarded the Nobel Prize in Chemistry to 3 scientists doing groundbreaking work on proteins.
No, I'm really excited across the board. I think in medicine, I think there's there's fantastic prospects for making better medicines, medicines that are smarter, that only work in the right time and place in the body, much more potent vaccines.
University of Washington scientist David Baker won the award alongside 2 others working at Google DeepMind in the United Kingdom. October is Breast Cancer Awareness Month. More and more younger women are being diagnosed with the disease. As Dr. Malika Marshall reports, the possible reasons may surprise you.
Hallie Goldstein has a history of cysts, so when she noticed a breast lump while showering, she didn't think much of it.
I'll get it checked out, but I wasn't super worried about it.
Within a few weeks, she was diagnosed with grade 3 invasive ductal carcinoma, an invasive form of breast cancer. She was only 29 years old.
I think I was more in shock than anything.
Approximately 11% of women diagnosed with breast cancer are under the age of 40.
And according to a recent report from the American Cancer Society, that number keeps going up.
We are seeing in the under 50 population a rise that's more steep than those in the above 50 population.
Dr. Ann Partridge is a breast oncologist at the Dana-Farber Cancer Institute.
We think some of the increase in the risk of developing breast cancer for young women is attributable to reproductive patterns. Women are waiting to have their first child till later and later.
Other potential causes include less physical activity, weight gain, and environmental factors.
So what I recommend for younger women is to know their own breasts and bring to medical attention any concerning signs or symptoms and changes, and to know their own family history.
And start getting mammograms by at least age 40. As for Hallie,
I'm very optimistic about Hallie and her treatment plan. And in fact, the vast majority of women diagnosed with breast cancer, including young women with breast cancer, will live through and beyond their breast cancer and do well.
My plans for life were just completely halted almost. So that can be frustrating, but I'm very grateful.
And grateful to get her young life back on track. Dr. Malika Marshall, CBS News, Boston.
New research finds some women are discouraged from breast cancer screenings because of false positives. The study from UC Davis shows only 61% of women return for follow-up screenings. Dominic Garcia spoke to the study's lead author.
To understand the latest study out of UC Davis, you have to know what a false positive is. In this case, it's when a woman goes in for a mammogram and doctors see something that needs additional screening, just to make sure.
So we found that women who have these false positives, they had to come back for additional imaging. Sometimes they had to come back for a biopsy, but they didn't have cancer.
So you might ask yourself, what's the problem? Better to be safe than sorry, right? But Diana Migloretti, professor and division chief of biostatistics at UC Davis, found that women with false positive results were less likely to return for a follow-up screening.
So it can be a very stressful period for a woman because she doesn't know what's going on. She thinks she might have cancer. And then she goes in for that imaging, sometimes even a biopsy, doesn't have cancer. She might feel like, oh, that was a big waste of time.
Health professionals want women to know that this can happen. And if you are called back for a follow-up, it's completely normal.
It's really important for women to understand that it's a normal part of the screening process. It's a frequent part. 10% of screening mammograms require this additional imaging. It almost always turns out to be normal.
False positives can happen for reasons including breast density and normal variations in breast tissue. Migloretti says doctors should explain false positive results, reassure patients, and stress that continued screening is critical. Dominic Garcia, CBS News, Sacramento.
There's now a way to test for COVID-19 and the flu at the same time. The FDA authorized its first at-home test by the medical company Helgen. people experiencing respiratory symptoms use a nasal swab just like the COVID tests from the past few years. Results appear in about 15 minutes. And in the fight against COVID-19, researchers studying the lasting effects of long COVID made a significant discovery that could lead to a potential treatment for thousands of patients. Suzanne Lemonnier has details from Chicago.
Long COVID patient Kevin Tenney says he was first diagnosed with COVID-19 in January of 2021.
Had trouble sleeping at night.
Tenney took part in a study at the Northwestern Medicine Comprehensive COVID-19 Center.
I remember getting like those CT scans a couple times, and the Dr. Sala would say, you know, I was a little inflamed, some nodules, a thick bronchial wall. I think that's what caused all the coughing, I believe.
It was through lung CT scans like this that Tenney's doctor, Dr. Mark Sala, would learn scar tissue was forming in Tenney's lungs and in the lungs of other study participants. Lab tests showed a certain cell type was the driving force behind the scarring.
The implication here is that if you can find a drug to target these cells specifically, it might help prevent all of that downstream injury and irreversible scar tissue.
Sala is also the senior author of a paper involving the study of long COVID patients at the center.
This has, over 4 years, resulted in an incredible statement about post-COVID care, as well as many other diseases that involve pulmonary fibrosis. And that cannot be understated, is that small contribution from each individual to a study like this is extraordinarily helpful for us.
Tenney says news his participation in the study could potentially lead to a treatment for pulmonary conditions means so much to him.
Just to be a part of something where we're learning new information that could help people in the future is great.
He's recovered from COVID 3 times since 2021 and said he's finally feeling better. Suzanne Lemonnier, CBS News, Chicago.
Coming up, we'll show you how some workplaces are prioritizing mental health. And researchers hope new genetic testing on newborns will help improve lives. Welcome back. Newborn babies are tested for dozens of genetic disorders, but researchers are expanding screening to look for more than 200 rare conditions. They're hoping to speed up diagnoses and treatment, as Tina Kraus reports from London.
At just 1 day old, Amelia is already making her mark in England as one of the first of 100,000 babies to have their entire genetic code sequenced to spot rare diseases.
It was no-brainer because Amelia will be tested for 200 different genetic conditions, so she will benefit, but also will contribute to the wider research population.
Researchers took a sample of Amelia's blood from her umbilical cord that will be tested to look for faulty genes in her DNA. Scientists will only screen for disorders that develop in early childhood and have effective treatments.
And the treatments and interventions which are available for all of these conditions can have a dramatic impact on that child. They can reduce the symptoms, and in some cases, they represent a cure.
I'm so excited. Yeah. 2 years ago, Joshua Curtis was full of life. He's now 9 years old and can no longer walk or talk. His condition, a rare brain disorder called MLD, is one that will now be screened for in the study. Joshua's mother is urging all parents offered the test to take it.
Speaking as a parent who is losing their child day to day, do not even hesitate. If you can save your child's life, that is more important than anything in this world.
If Joshua's condition would have been detected at birth, he may have been cured, but now the damage cannot be reversed. Researchers hope screening for more conditions sooner will give newborns the strongest start possible to living their best life. Tina Kraus, CBS News, London.
An art studio in northern England is also a charity that gives people a way to work through their mental health struggles through the creative arts. Members say Chili Studios offers an opportunity to try and even fail at different things.
It just really instills confidence, I think, because every piece of art you make
you're the only person who's ever made that piece of art. You've done something that no one else has ever done. It can give you something to be proud of when you don't have anything to be proud of.
Angela Oliphant has been coming to Chili's since her father passed away.
My passion at the minute's knitting, and it just helps with my mental health because when you're focusing on your knitting, your mind doesn't work overtime.
The studio has been operating for 20 years, but has had to scale its operations back due to funding cuts.
This is a safe space for so many people. Some of our members have been coming for many years. Not having that port in a storm, if you like, could lead to problems further down the line for individuals.
The studio is now raising funds by auctioning off its members' artwork. October 10th marked World Mental Health Day, and this year's theme, prioritizing mental well-being in the workplace. We visited one company trying to help its employees.
That's the sound of silence at Uber's offices in Lower Manhattan. This quiet room is one of several provisions the rideshare company offers to help its employees with their mental health.
We just come here on our laptops with a cup of coffee. When I work in a focus time, I'm able to think of more ideas.
This World Mental Health Day is focused on prioritizing mental health in the workplace, no matter where you punch the clock. Recent surveys show mental health symptoms have improved since 2021, but workers' views of overall mental health have declined. Less than 40% said their employer prioritizes mental health.
Employers should drive the promotion and improvement of mental health of workers.
Dr. Chiching Zhou of Johns Hopkins Bloomberg School of Public Health says a downward trend was noticeable with return to office policies.
Forcing people to fully working in person may not be necessarily the right thing for productivity and well-being.
Uber's corporate employees can work half their schedule from home, and a recent survey shows workers who are hybrid by choice report shorter mental health symptoms, less stigma, and a better relationship to their job.
Employees can also play an active role in their mental health. Express gratitude, which benefits everybody. Practice good email etiquette. Set aside meeting-free days. Practice mindfulness and deep breathing. And be a source of social support for your colleagues, especially if you're in a supervisory role.
It's a simple philosophy that if you take care of me, I take care of you.
All steps to bring a little more well-being into the workplace.
After the break, the value this pricey mannequin brings to medical students. And a pair of astronauts trade messages of bravery and hope at a children's hospital. Welcome back. A unique program aims to recruit and train the next generation of doctors with the goal of encouraging more minority students to pursue medical careers. We go inside the training ER where they're getting hands-on experience.
It looks like an emergency room and sounds like one.
Come on, open your eyes, sir.
But the patient on the bed is a mannequin, the caretaker's college students.
What were you doing earlier today?
It's part of a program at Albert Einstein College of Medicine in the Bronx. For decades, it's helped Black and Latino students from New York begin careers in medicine.
Graduates from this program become doctors. They become residents.
Nationwide, less than 7% of physicians are Hispanic and less than 6% are Black. Boosting those numbers could help improve care for minority patients.
To see a physician that looks like them, talks like them, shares cultural nuances that they don't have to explain certain things.
Juliana Dominguez-Paez was a participant a few years ago. Now she's in medical school.
As someone who's like first generation and didn't have anyone to really talk about medicine, I'm like, this is the perfect opportunity.
The free program includes hands-on time with doctors, networking, and this simulation training that's a highlight.
I don't feel good.
These mannequins can cost $100,000 each. They are real training tools used in medical school.
1, 2, and 3.
A prescription to help young students start to think like doctors.
To feel like a patient is like going through a thing right now and like figuring out what they have and what we can do to make him feel better.
And someday soon, they could be making a difference for real patients.
A 24-year-old Irish student is trying to limit the hair loss that comes with cancer treatment after seeing how her own mother dealt with it. Olivia Humphreys says her prototype, Athena, improves upon the scalp cooling treatments typically used during chemotherapy.
I've kind of optimized what currently already exists, but it's the early stage idea of, making a low cost cooling device that could be more accessible than what's currently on the market in hospitals.
Cooling the scalp restricts blood vessels, which prevents chemotherapy drugs from reaching hair follicles and causing hair loss. Humphrey's mother lost about 40% of her hair and told her daughter the current devices needed improvement. So she created Athena, a portable headset that allows patients to start the cooling process while on the way to the hospital and then move around once they're there.
She was so spot on. She came at it from a complete functional, you can do something here, may it be small, may it be big, that would make a huge impact, no matter what you do. It's a tough day, it's a tough process, anything could help. So
some say losing their hair from treatment is just as bad as having the disease. One study found half of patients consider it a traumatic experience. 2 astronauts met up with some brave kids and their families at one of San Francisco's major medical centers. As Elizabeth Cook shows us, at the end of the encounter, all were left inspired to reach for the stars.
Try it on.
All right, let's see.
There you go.
At UCSF Benioff Children's Hospital at Mission Bay, the sky's the limit.
We have patients here who are on hard journeys. And then we have astronauts who have done some challenging journeys themselves, and they're sharing stories and helping each other.
1, 2, and 3. On this day, the medical center met with NASA Ames and the Johnson Space Center to explore ways to accelerate cancer care and research. But in the auditorium, 2 astronauts, Kenneth Cockrell and Yvonne Cagle, met with families touched by the disease, signing autographs and posing for pictures. Cagle is also a medical doctor.
What we do to prepare and how we not just survive, but sustain and even thrive in space is not unlike the journey that individuals going through these kinds of treatments.
Cockrell, nicknamed Taco, is a veteran of 5 space flights. He is also a patient.
I'm hoping to be inspirational to some young patients, and I think I can bring something else to the table because I also have cancer.
Happy birthday to you. Okay, all right.
The astronauts visited several patients in their rooms, serenading Jackson Nystrom, who is fighting round cell sarcoma.
I enjoyed it, took my mind off my chemo, and really learned some cool things.
2-year-old Luke Medina Benson loves Buzz Lightyear. In fact, any story about outer space. He's battling brain cancer.
We appreciate all the cool stuff, like the astronauts coming by and all that stuff.
Finally, a visit to 18-year-old Claire Felton, diagnosed 2 weeks ago with leukemia. The visit inspired her to consider a change in her major to space sciences.
Now that I have seen all of this, I'm much more interested in spatial research.
Good morning, how are you?
The astronauts were equally impressed and inspired.
They were fantastic. Those guys had an attitude that's going to carry them through, I think.
More than survivors, they're role models, and I would fly with them any day.
To infinity and beyond.
A great mission here on Earth. That's this week's Eye on Health. I'm Bradley Blackburn. Thanks for joining us, and be well.